So ISNCC is currently developing a position statement on cancer nursing leadership. Very much we believe that nurses have a leadership role across the whole cancer control continuum, involved in education, clinical practice, research and policy. But cancer nurses need to be empowered to take that leadership role. And so we've been developing this position statement. If we think about how do we identify it as a priority, well, you just need to look at some of the reports that have come out lately, the Triple Impact Report, the State of the World's Nursing Report, the ICCN document on Nurses: A Voice to Lead, and then the Global Strategic Directions for Nursing and Midwifery, where leadership has been identified as a key area for nursing development. And so very much an important position statement for us as ISNCC. Progress to date, well, it's been approved by the board, we've done the literature review, we've done some initial drafting of the position statement, and the working group are just carrying out some edits on that, and then it will go to the Policy and Advocacy Committee, where it will be amended, go back and forth until we've got something that we're happy to send to the board. So hopefully we'll have a draft to send to the board in the next couple of months. So that has been being developed over the last year or so. It got delayed a bit because of COVID, but we're working on that now. And I think one of the things that we were talking about in our plenary session was the importance of knowing who's the right person to lead the development of a position statement, and the importance of collaboration. Some of the ISNCC position statements are joint position statements with other organisations, such as with the Oncology Nursing Society, with the European Oncology Nursing Society, etc. And so the one on children's palliative care is actually being led by the International Children's Palliative Care Network to develop a global children's palliative care position statement and advocacy campaign, and that's work that I'm doing in my day-to-day work, but very much working in collaboration. So it's just at the initial stages. We've developed the concept paper for the development of the position paper. We're wanting to work in collaboration with a range of organisations, so it's endorsed by a range of global and regional organisations, and then planning an advocacy campaign to go alongside that. So we're going to be leading it through ICCN, but we're wanting to get ISNCC, other nursing organisations, ICCN, etc. involved, different cancer organisations, palliative care organisations, patient organisations, and then bilaterals such as the WHO and UNAIDS. So really bringing together a regional and international collaboration to strengthen that position paper, and to try and get a global voice looking at the need for children's palliative care. So I'm just in the stage now where I'm about to approach possible collaborators and begin to develop that position statement. We've undertaken a literature review, looked at different formats of position statements, and now are in the position to move forward. So that's something that we hope to be doing with ISNCC, along with other organisations globally, so that we have a really strong collaborative position statement.